We'll have an interactive discussion after the next speaker. When you've got children, it's not very pleasant watching them squabble. Of course, when you have a brother or sister, it seems a very important battle to have. We're very lucky to have Christian Hamm here as our father or parent to look on and give views about what's right and what's wrong. We have a lot of excellent faculty, as you can tell today. Professor Hamm is from Bad Nauheim. He's Director of Cardiology there, and he's the current President of the German Cardiac Society with a mere 8,000 members. So, Christian, we're very pleased to have you here. Thank you.
Well, thank you very much again for inviting me and a chance to give this talk, although I feel very lost in the moment. It's my first talk on off-pump surgery. But I'll try my best.
Could I ask you, but you do most of your PCI off pump?
Most of them.
Yes?
More and more, yes. But the question is, do you really want my view as a cardiologist to this topic? And do you need my view? And the question is whether I can provide a sensible view to you on this topic. I'm a great believer in the heart team, you know, but I think here we reach the limits because I think when it comes to the technique of a cardiologist or the surgeons, I think you should decide yourself. I want to make the decision which stent to implant, and I think you should make your decision which technique you using for doing your surgery. Now, but I must congratulate you that you have really a very nice series of randomized studies, which are not so frequently found in surgery, and you have already, I don't want to repeat these studies, the coronary studies, you know, that how the outcome was, no difference, and you have the Ruby study, basically no difference, at least from the view of a cardiologist, and we have the CABG study in the elderly patient, basically no statistically significant difference. Now, however, there are some concerns from the cardiologist point of view. And one concern, of course, is graft patency, although this may give us some work to do and place stents in arteries that have been that the graft is occluded. But this year, that the occlusion rate is higher in off-pump surgery, at least is some concern, and that needs to be solved, of course. Some other concern may be on the positive side, that stroke rate may be lower. I think that's probably very interesting, but that's also not so much consistent finding. It's very difficult to show. You have discussed this in the previous presentation, so I don't need to repeat this. My point of view or my wishes is if you want to perform off-pump, you're very welcome as from the cardiologist point of view, but it seems like that then you should do it with the no-touch technique, because then really neurologic complications seem to be rarer as compared to the touch technique. Now, further concerns from the coronary study potentially is, from my point of view, that in this study it looks like that the experience of the surgeons played no role. So it seems to be a little bit intrinsic to the technique, and I know that there are some other data, but at least not in this study. And here in this study, there was no statistical benefit in patients with single vessel disease, and there's no difference, but these patients may be candidates for a real off-pump, as David says, that's the performing PCI maybe in such patients. That's the real off-pump procedure. However, there are a few studies comparing off-pump with PCI, and 10 studies with 4,800 patients, 3,400 PCI, 1,300 OPCAP, and there are similar rates of stroke, interestingly, so you're doing at the same rate as we performing PCI. Similar rate of myocardial infarction, mortality is not different, and all-cause mortality is not different. But you do find what we know from other trials, like from the Syntax study, that the 12 months MACE and TVR rates are significantly better in surgery, in this case, for the off-pump surgery. So it does not seem so much on the technique you use. It seems intrinsic to the differences between PCI and surgery seem to be intrinsic to the general approach. It's another study. You cannot read the top line, but it's a patient here compared off-pump versus PCI in mainstem lesions. He also has similar finding, as we know this from syntax. No difference in death rate, at least here for the early follow-up. There's no difference in stroke, no statistical significance. PCI had no strokes here, but you do find the differences then in myocardial infarction rate, TVR, and the MACE rates. I really don't have very much to say. The conclusion from my side is here in this cartoon that I found by incidence, to say to all surgeons, if there are two or several of them, that they should never quarrel about the patient for what would frighten the patient very much. So this is the only advice I can give from a cardiologist point of view. Thank you very much.